When we think about the biggest challenges in India's healthcare system, our minds usually jump to things like, say, infrastructure or access to care. But there's another crisis, a quieter one, that's unfolding right now. And it's not happening in the operating room, it's happening in the finance department. We're talking about a critical cash flow crisis, and believe me, it has the potential to threaten the stability of the entire system.
So here's how we're going to break it all down. First, we'll uncover this hidden problem. Then we'll look at the pretty staggering numbers behind it. We'll also explore the three market forces that are making things worse, understand the real-world impact of all this, and finally, look at how technology might just be the solution, turning this into a new strategic imperative for the industry.
All right, let's get right into the heart of the matter. The fundamental issue here isn't a lack of patients, and it's not a lack of medical services being provided. No, this is about the financial health, the very viability of the hospitals themselves. The backbone of our healthcare system.
And this is a problem you can't really see. It all happens behind the scenes. It's like a slow, steady squeeze on a hospital's ability to even operate, all because the money that it's owed, well, it just isn't showing up on time.
And this really sums up the core conflict, doesn't it? A hospital delivers life-saving care to a patient today, but the actual payment for that service might not arrive for months. This creates a really dangerous gap. They've earned the revenue on paper, sure, but the cash simply isn't there to pay their own staff, their own suppliers, their own bills.
Now, let's look at how this all adds up, because the sheer scale of this problem becomes incredibly clear once you start looking at the hard data.
So there's a key metric for this, and it's called Days Sales Outstanding, or DSO for short. It's a pretty simple measurement, really. How many days does it take for a hospital to get paid after it's provided a service?
Well, in India, that wait is somewhere between 60 and 120 days. Now, to put that into perspective for you, the global average is already considered high at around 45 to 70 days. So Indian hospitals are waiting significantly longer, which puts this immense, crushing pressure on their working capital.
But wait, it actually gets worse. A huge chunk of these payments isn't just delayed, they're rejected outright, often because of really complex paperwork or, tiny coding errors.
And that brings us to this absolutely staggering figure. In just a single fiscal year, FY24, a mind-boggling 26,000 crore rupees in health insurance claims were flat-out rejected. That's more than the entire annual budget of some Indian states. It is a colossal amount of earned revenue that has just vanished from hospital balance sheets. So you have to ask, right? Why is this all happening now? What's making it so much worse? Well, the answer really lies in three powerful market forces that are all colliding at the exact same time. It's a perfect storm.
First off, India's insurance market is just booming, which is great, but it means more and more hospital revenue is now subject to these lengthy payer approvals. Second, the regulatory environment is getting way more complex. And third, the level of scrutiny on every single claim is getting tougher and tougher.
And you can really see that scrutiny in action here. Just look at how wildly the claim settlement ratio varies depending on the type of insurer. A hospital has to navigate this incredibly fragmented landscape where, one payer might approve claims easily while another might reject more than a third of them.
Now, this kind of financial pressure, it doesn't just stay locked up in the finance department. It creates a ripple effect, a domino effect, really, that impacts every single aspect of a hospital's operations. And ultimately, it impacts patient care itself. Think about it. When cash is all tied up, hospitals have to delay buying new, critical equipment. They struggle to pay and retain the best doctors and nurses. Their relationships with essential suppliers become strained. And really important projects for improved patient quality and safety, they all get put on the back burner.
This kind of environment also creates a really clear divide in the industry. The large hospital chains, well, they can use their size and scale to negotiate better terms and absorb these delays. But for the smaller, independent hospitals, this constant cash flow pressure can be an existential threat.
Okay, so we've laid out the problem, the causes, and the impact. Let's turn to the solution. The path forward, it seems, lies in using technology to bring some much-needed efficiency and standardization to what is a pretty chaotic process right now.
The whole goal is to streamline this entire journey, from the moment a patient receives care to the moment that cash is actually in the bank. Technology can automate and optimize every single step, from getting that initial claim right to managing any denials and appeals efficiently.
And you know what? The results are really tangible. Modern revenue cycle management platforms, or RCM, have been proven to reduce those costly claim rejections by anywhere from 15 to 25%.
They help hospitals get more of the money they've rightfully earned and get it faster.
And all of this brings us to our final and maybe most crucial point. Managing cash flow is no longer just some administrative chore. It's now a core strategic function that's absolutely vital for survival and for growth. The conversation around revenue and cash collection has to move. It needs to go from the back office right into the boardroom. Hospital leaders, investors, they have to prioritize it, they have to invest in it, and they have to measure it as a key indicator of the health of their business. And we are already seeing the market respond to this urgent need. New technology platforms are starting to emerge, built specifically for the unique Indian healthcare context. They're designed to integrate compliance with new regulations and use automation to tackle these payment challenges head-on.
So ultimately, this leaves us with a critical question for every single healthcare leader and investor out there. In an industry that operates on such razor-thin margins, is your cash flow just a constant struggle to be managed, or can you turn it into a powerful strategic asset that actually fuels growth, quality, and long-term resilience?